Hello, it's good to have you once again. Your health, your life. Today we have a guest on our show. Our guest is Dr. Kwangu. Welcome, Dr. Kwangu.
Thank you, and thank you, viewers.
All right, that's good. Before we begin, maybe just tell us a bit about yourself, Dr. Kwangu. What do you do? Where do you work from?
Basically, my name is Kwangu Mwamba, known as Dr. Kwangu at St. Francis Hospital. Currently, I'm a registrar in Obs and Gyne doing my second year this year. Basically, that's the basic information about me.
Okay, so Dr. Kwangu is here to promote the health of women. As we know, much has been dedicated to all women in the world. We had our Women's Day just a few days ago. So without further ado, we're going to get into the topic of today. Today we're going to be talking about fibroids. So I think the first question I'd like to pose to Dr. Kwangu is, what are fibroids? Generally, how can you explain them to the audience?
So basically, in a layman's language, I can say fibroids are benign tumors of the uterus. These are growths which they originate from the uterus. That's in a basic, in a layman's language, but scientifically, these are benign tumors of the uterus, which contain smooth muscles and also connective tissue.
Okay, thank you. And by the uterus, you mean the womb?
The womb, yes.
Yes, where the baby is.
Yes.
Okay, so you have a tumor there or a cancer there. It's not a cancer exactly.
It's not really a cancer as per se. The word tumor can either be malignant, where it becomes cancerous and so on and so forth. But when we say benign, it doesn't mean it has developed into cancer and so on and so forth. It's something that cannot grow very fast. It can easily be removed and the patient can go home.
Okay, so that should be clear for everyone now. It's not a cancer. Fibroids are not cancers. Why should women of reproductive age be aware about fibroids?
So women of the reproductive age should be aware due to the fact that when this woman gets pregnant, a fibroid can complicate the pregnancy. It can be during the pregnancy, that woman can lose the pregnancy. Even before conception, a woman can have difficulties to conceive, that one who has fibroids. And if they conceive, the pregnancy goes to term, that woman is at risk of bleeding after delivery, and so on and so forth.
Okay, so every woman of reproductive age at least should be aware that fibroids are there.
Yes, yeah. Every woman should know about fibroids and how they can be managed and what can be done when they get pregnant and how they should be followed up.
Okay, what causes fibroids?
So basically the cause of fibroids is not known. However, there are some associated hypotheses that have been written by some obstetricians and some other scientists to talk about some of these things. There are things like chromosome abnormalities, where you find there is a deletion or rearrangement in chromosome number 6 and 7. Those can lead to the formation of fibroids. The other things that have been talked about are the roles of polypeptide growth hormones, things like insulin-like growth factor 1 and also epidermal growth factor. Those have been associated with the formation of fibroids. The other thing is family history. Find that the mother, the grandmother, they all had fibroids, so it keeps coming like that. Otherwise, the actual cause is not really known. It has not been found scientifically, but we don't know where we are going. Scientists may come up with all sorts of theories to try and find the cause.
Okay, so for every person out there listening to this show, generally what we're saying is that it's not really clear why some people have fibroids.
Yes.
But they may run in families.
Yes.
Okay. And then for the growth insulin factor polypeptide, it's for those now.
That is for the scientists now to understand. The layman, yes. Okay. The layman people, please take that as just a by the way.
All right. Thank you very much, Dr. Kwangu. So somebody has fibroids. They test and we find them. They have fibroids. How are we going to treat them?
So before we reach to treatment, actually, we need to understand how are we going to reach to this point where we say, now this patient has got fibroids? We need to know the symptoms of this condition for us to make a diagnosis basically of fibroids. The main symptom that a patient with fibroids will come in with is bleeding. Most of them, they present with prolonged menses, and they complain that others will present with the intermenstrual bleeding, what is known as metrorrhagia. And if they present with the intermenstrual bleeding and heavy menses, we call that as menometrorrhagia. So that's the most common symptom that the patient will present with. Due to the fact that they are bleeding, so they also present with anemia. And they will present with signs and symptoms of anemia, dizziness, palpitations, headaches, and so on and so forth. So, and then the other thing, fibroids has also been associated to failure to conceive in certain women. Again, at the same time, those who do not conceive, they also tend to be found with fibroids. So there is that confusion whether it's not conceiving, or the fact that they are fibroids, that's why they have not conceived. So that relationship has not yet really been understood. However, the most common symptom is abnormalities in the menses, which we should investigate further, because there are other things that can cause abnormalities in the menses, but the commonest is uterine fibroid.
Okay, so uterine fibroids can cause menses to prolong, the
Yes.
bleeding themselves. Then some women may bleed many times during the month,
Yes.
like you have highlighted. Then it may also be associated with inability to conceive.
Exactly.
Okay, so some patients may be failing to conceive. It may be because of a fibroid.
Yes.
Yeah. There's also something about fibroids and abortions.
Yeah, that one is true. Actually, if a patient has got fibroids and then they get pregnant, they easily tend to miscarry. The physiology behind is simple. Basically, the baby and the fibroid, they tend to fight for space. That's one. The other thing is if there is a submucosal fibroid, the endometrial part that is covering the submucosal fibroid may end up losing vascularity. In short, blood supply there is impaired. So that affects implantation of that fetus or that embryo, and hence it will come out.
Okay. So, like you've said, it's maybe because there's not enough space for both the baby and the fibroid itself. Yeah, and sometimes the blood supply that is supposed to sustain the fetus may be affected, causing the miscarriage. Okay. So I think that's just something that people should take home, to know that someone who constantly have miscarriages should always go to the hospital, so we check them in case they may have a fibroid.
Exactly.
Yeah. So now that we've talked about the symptoms of the fibroids and some of the things that may be associated with, how do we treat them?
So now on treatment, so basically when you're treating a patient with fibroids, there are two ways which we use. Of course, there is the medical part and the surgical part, which is definitive. But for the medical part, they go for using medical treatment is basically to reduce on the symptoms. One, you have to handle their menstrual cycles. These are patients who are coming in with heavy menses and so on and so forth. So you tend to give them drugs to reduce on that bleeding. Then they may come with anemia. You tend to supplement them with hematinics, or if there is need be, you transfuse.
Okay.
And then you help that way. And then you give certain medication to try and reduce the size. According to literature, you try and reduce the size of the fibroid if it's too big, which we rarely do, but it can be done. And if you do that, then you prepare the patient for surgery. You can either remove the fibroid itself if the patient has got satisfied parity, or you can remove the uterus. That is, if the patient has got satisfied parity. If they still want to have children, you can decide to remove the fibroid. And just removing the fibroid doesn't mean that you've cured, because they can reoccur. The place where they come from is the uterus. Once it's there, they will still reoccur.
Okay. And by satisfied parity, we mean a woman is comfortable with the number of children
that they have.
Okay. So that's just something that you should know. Yes. That if you're comfortable with the number of children you have, then we may advise that you remove the whole uterus.
Yes.
It's not like we're going to force you to remove it.
Exactly.
Okay. So what do you think would be the take-home message for women in the community that don't have fibroids? Why is this important for them?
So, those who do not have fibroids should not laugh at those who have fibroids. Actually, those who do not have, they should encourage those who have fibroids to come to the hospital, to be attended to, and to be helped in their problems that they are facing. Those who do not have, it doesn't mean they may not have forever. At one point or the other, they may have, and they will become like those who have. So they should not laugh at the others. They should just encourage them that, and they should bear in mind that once there is a uterus in their body, they are prone to having fibroids.
Okay. What about for those that have fibroids? What would you advise them?
So to those who have fibroids, it's not the end of the world. Fibroids can be removed. Fibroids can be treated medically and so on and so forth. Symptoms can be resolved using medical methods. So it's not the end of the world. All you need to do is just seek medical attention, go to the right places, get correct medication, and you will get the correct treatment and get the correct advice from the medical people. And then you live your life one at a time.
Okay. This is very educative. I think a lot of people would benefit from this, considering that I'm sure you see quite a number of people that have fibroids in your hospital and the clinic.
Exactly.
Yeah. Okay. I don't know if there's anything else that you'd like to give us.
Actually, I just want to add a few things on the symptoms. You find that as the fibroids are growing, they can cause pressure, what we call pressure symptoms. These symptoms where the fibroid has overgrown and it has compressed the ureters. When that happens, you find the patient will be coming with abdominal pain, frequent abdominal pains, due to the fact that the ureters are blocked. So urine is not passing from the kidney going to the bladder. Hence, that will cause pyelonephritis and so on, and backward pressure, hydronephrosis, hydroureter, and so on and so forth, causing pain in this person.
Okay.
Yeah.
I think that's just something people should also realize. That sometimes fibroids may present, like you said, with pressure symptoms. They can compress on the ureter, then the kidneys become bigger.
Exactly.
They may have a UTI in the process because of all that. No, thank you very much, Dr. Kwangu. It's been a pleasure.
Thank you.
We hope to have you again.
No problem. I'll surely come through.
All right. Thank you very much, folks, for listening. And this brings us to the end of our show today. Don't forget to subscribe to our YouTube channel for more content like this one. Have a lovely day.